You're listening to Aging Uncensored.
Okay, welcome to Aging Uncensored, the podcast where we unravel, dive deep into everything senior care, aging, whether that's, caring for our parents, caring for a loved one, working in senior care, and even raising children throughout this journey. But Aging Uncensored just tackles all of the big things. We dive deep, and today we are so excited to have on our podcast for a two-part series, Miller Piggott. Miller is the executive director for Alzheimer's of Central Alabama. And again, I'm Christy Baines, your host today, and so excited to have Miller. We've been a longtime friends. Miller, I met you when I was still in undergrad pursuing this journey in geriatrics. And wow, what a journey. And now I'm seeing your wonderful daughter, Polly, at the Brain Aging and Memory Clinic as one of their lead nurse practitioners. I was actually with her last week with a patient. And the first time I met Polly, or the first time I saw Polly, I believe Polly was getting her portraits done by a local photographer, Barbara Harbin. So it's been a while, right?
It has been.
So just a little bit for our listeners and our folks that are watching us on YouTube to know, Alzheimer's of Central Alabama was started here in Birmingham, Alabama. And I'm going to let you have the history, but it started obviously with a local focus within a couple of counties, and now you're serving the entire state. We've been very involved with ACA for a long time, as well as several of our team members. And, just if you're going to be part of philanthropy, when you can say something like, is it 91 cents or
91
cents of every dollar raised goes to the services that you provide. And those services are much needed and very impactful into the people that don't have the opportunity for the services that you're providing. So tell me about ACA. How did it get started? And let's just kind of go from there.
Well, 35 years ago, I was hired in what was then called the Center for Aging at UAB. And they had a program that was called the Alzheimer's Society. And the Alzheimer's Society at that time was leading one support group once a month in the Birmingham area. And when I came on board, I quickly started support groups in various locations around town, Gardendale, Jeff State, Bessemer, Shelby County. And really from those support groups, Alzheimer's of Central Alabama was born. The caregivers that were involved wanted to be their own advocates. They wanted to make a difference in the lives of families who were going through this journey. And there wasn't really anything else, but we decided early on not to join a national association and to stay local. And throughout our history, that has really served us well. And I remained at UAB, but then retired from there and came on with ACA full time. And the organization, I don't know, Christy, sometimes I think it's just, it's almost magical or spiritual that, we have always gotten the things we need, have the support that we need so that we can continue to serve families throughout Alabama.
Absolutely. It's like the little engine that could, but that little engine keeps picking up more and more steam and doing more things. So I guess I was vice president and president of the board in the 2006, 7, 8 range, I believe, or 7, 8 range, 7, 8, 9 range. And back then we had a wait list, right? And now with all the things that ACA has been able to develop over the last 35 years, you don't have a wait list for these services.
We don't have a wait list, but I always think I'm pushed along by very zealous board members And one of my board members said, we don't need to have any waiting lists, and we need to raise the money to serve the number of people. But Chrissy, I also have to tell you, no waiting lists also means that we serve people who are very vulnerable.
Yeah.
And so there's a lot of attrition, where people are either, it's the end of their journey or they're moving into a nursing home. But the big thing that's really important to note about ACA services is that we follow people throughout the course of the journey. I mean, we're with them as long as they need us. Our services are not time limited. They are intended to serve families for as long as they need the support.
Absolutely. Let's unpack all of those services. So you mentioned the support groups, and obviously that's where you started with the Alzheimer's Society, right? I had no idea we were called the Alzheimer's Society.
I know that sounded like such a, I don't know, hoity-toity name. That I changed it to the Alzheimer's Family Program, and I'm not even sure they still have that program at UAB. But Betty Roberts did that program.
Oh yeah, our friend Betty.
Our friend Betty for many years. So yes, those services continued at UAB. But what ACA did was sort of fill some unique glitches in the system where there were not the things that families needed. And I always like to say that we offer services for every stage of the disease. Mm-hmm. And so certainly what we say is that a family's first line of defense when they're first diagnosed with Alzheimer's disease is education.
Yeah. And let me ask you this, because some people may ask, is it only for people with Alzheimer's?
No, not necessarily. I mean, we've got people with, with frontal temporal dementia, with vascular dementia that get on our Zoom calls and support groups. But by and large, most people do have Alzheimer's, and that's also important to note just from a diagnostic standpoint that a lot of people have mixed dementia anyways. They may have more than one thing that's going on, may make their care complicated. And so we certainly don't turn anybody away. But we always want families to seek out what suits them the best. And so if that's finding a support group for people with FTD, frontal temporal dementia, that is specific to that, then maybe that's what they should do. But we're just one offering, and we hope to serve an unmet need.
Right, absolutely. And so some people will say, well, my mom has dementia, but she doesn't have Alzheimer's. Not real sure, right? Right.
People say that. Say that. And if it quacks like a duck, it's a duck in our book. And so, we're here to help.
Absolutely. And so that's what I want everybody to understand, that if your loved one is experiencing brain changes and it looks very similar to any of the forms of dementia, ACA, the state of Alabama, is your go-to resource for things that are, you've got the statewide support group panel, where people can find their support groups, relationships with the daycares and the respite programs. And then obviously we're going to dive into the specific services that ACA provides these families. So let's kind of dive into that. I'm a family member. And how do families typically hear about ACA?
Sure. Well, we get our website, Christy, gets about 28,000, got about 28,000 hits in 2024, which I don't know how to compare that to anything else, except that sounds like a really big number for a local nonprofit. And so we're really proud of that. And so there's obviously a lot of people that are out there clicking around trying to find information in general. And I hope that they find what they're looking for when they land on ACA. So, we try to keep our website up to date and talk about the services that we provide and also what's going on in the community, because, you said earlier, and I don't want to jump the gun for the questions that you're interested in covering, but people don't have to live with Alzheimer's in isolation anymore. There's a community of people out there that are going through this, that are experiencing it, that can help at various stages. And so the more families are open to that, the more help that they're going to find. And that can be very normalizing of the disease so that people don't feel so isolated. And it can be very comforting as well.
Absolutely. Yeah. Just knowing that you don't have to have this journey by yourself. And, you're not going to just have the 36-hour day and say, hey, try to make this work. Right. I mean, now there are more and more resources out there, and you've seen this, right? And we'll talk about this more, but you've seen where you were 35 plus years ago with the Alzheimer's Society and things like that. Um, Although back then, 35 years ago, the research that, our friend Alan Stevens and Dr. Lou Bergio, Dr. Stevens, Dr. Rebecca Allen Burge, what they were doing 35 years ago in the research for supporting family members is finally getting to, a place where Medicare is recognizing it, which we're super excited about. It's, what we've always known is if you support the family member, the person living with dementia is going to have better care, and the family giver is going to have better health, because we see such a decline in the family caregiver.
Absolutely. That is absolutely true. And yeah, it's things have kind of come full circle as far as that goes. And so that's why it's really vitally important for families to reach out to all the various sources of help. But if you need one place to start, Alzheimer's of Central Alabama is a good place. Our website is a good place as well to get some much needed information.
And what is your website? Because we'll put this up on the screen when we're doing when we do the whole taping of the program. But what is your website?
Well, it's just an abbreviation of our name, which makes it really easy. It's alzca.org. So like Alzheimer's Central Alabama, alzca.org.
Aren't you glad you got that domain a long time ago?
Yes, I am. Yes, indeed.
So when I go to the website, kind of navigate through what I need to find. So for the support groups and the other things that are on there, and then try to get to these resources specifically that you guys provide.
Well, how we can help, if you're interested in our service programs, and our service programs are targeted for low income families. But if you are looking for services, that's the place to start. The applications for those programs are right on the website, and you can fill them out there. There's a list of support groups. There's a list of daycare centers and respite programs. It talks about our fundraisers. There's just good information on there. But one thing I want to be sure people are aware of, we put out an email this is starting back with the education piece. We are putting out an email every Friday, and we call it the Dementia Community News. That's what it basically is. And it lists everything that's happening that week. And you would be surprised. There's always programs, there's webinars, there's things you can do in person. And then it lists all the support groups. But then underneath that, there's a recap of what's gone on research-wise or just in the news-wise with Alzheimer's that week. And there's a lot. There is a lot every single week. And those are archived on the website. And so you can go back and look and find information related to just about any topic related to Alzheimer's disease that you're interested in.
That's great. It really is. I love getting that the weekly email. Honestly, when we build out our resource library for the guide model, we have used your newsletter. We've used your email to find all the support groups, to look and see what are the resources out there. Because there's, like you said, way more than I can even keep up with. You guys have been such a great hub for all of that information, because you also have kind of nationwide things that are going on, statewide, and then dialing it down to a specific area. Okay, right. So obviously education is a huge part, and anybody can come and find the education. Anybody can come and find the support groups and things like that. Are y'all still doing, I know that we used to have color-coded sheets, right?
Oh, yes, we have, and those are on our website as well. We have two sheets that I like a lot. One of them, it's got a lot of kind of, when I say old fashioned, I'm just talking about it's the language that we used 35 years ago. It calls the person living with Alzheimer's disease the patient, for example, and That's not really the language that is currently used. But this handout, I mean, we used to probably run it on the memory graph machine. That's how old it is. And I love it because it just gets right to the heart of things, the basics. Don't reason, don't rationalize, don't argue. It is very clear, it's very understandable, and it is an aha moment for so many people when they read that, because the strategy that people tend to use when just dealing with Alzheimer's on their own is to explain.
Yeah.
Is to help. You remember this, Mama, you know this, or all of those kinds of things that aren't very helpful. That one sheet alleviates that. And I think that people don't realize, when you continue to try to push your loved one to remember, or you shame them because they can't remember or they can't
Quiz
think.
them, right? Quiz them to
Quiz them.
see how their memory is. Yeah, all those things.
But you build up tension between the person living with the disease and the person who is the caregiver or the care partner, and it breeds it breeds distrust. It which forms the basis of paranoia, and it sets the tone that you do not want in this disease. And so, learning those basic communication skills is vital. The other one we like a lot is the blue sheet. So we got the yellow sheet and the blue sheet.
Yeah.
And the blue sheet, the very, very brilliant, very compassionate local physician, internal medicine, Renee Harmon. She's written a book called Surfing the Waves of Alzheimer's. Renee is our vice president right now. We're proud to have her as part of ACA's team. And she took the yellow sheet and she updated it. So there's where you get the more and more updated version that is very person-centered, and it gives communication strategies throughout the disease course. And so it's a lovely companion piece. And I think those things couple together really give families a good overview of how to communicate and how to care.
Absolutely. So are both of these sheets downloadable from the website?
Yes, they are.
Great.
Now they don't come out on colored paper, but we like them on colored paper, and I'll tell you why. Because even now we will get calls at the office and they'll say, a long time ago I had this yellow sheet and it was real helpful and I gave it to my neighbor and I need another one. And so it's just a way of identifying it.
Absolutely.
But that has happened so much over the years that we've kept it yellow.
There you go. So if I go to the website and I'm looking for these sheets, are they named something specifically on the website?
They're the communication sheets is what they're.
Okay.
Yeah. Perfect.
That's great. And again, those are extremely handy. They're just front and back, right? They're just front and back, 2 pages. I'm not giving you some book that you've got to go and read. Super easy. Of course, if somebody wants to read, obviously you'll have plenty of resources for that. But they have been just kind of the mainstay family caregiver, care partner resources for a long time.
Well, you're right. And the fact that it is just one sheet is really helpful. I know a lot of people have stuck it to the refrigerator, keep it in the bedside table drawer, because certain caregivers, this don't reason, don't rationalize message is harder for it to sink in than others. And so I've had a lot of families over the years say, I have to read this every day. I have to remind myself of this constantly. So, it's all of us, our natural tendency is to reason with someone.
Absolutely. Absolutely.
So you do have to train yourself. It requires some training.
Yeah. You and I both have done this for quite some time. And then when we had our own family members that had brain changes, I know you did better than I did, but I would fail miserably sometimes with my dad.
I failed miserably with mine. I can think of a couple of examples, but I can remember hanging up the phone from a conversation with him, and my husband looking over at me and say, "Aren't you supposed to be the expert in this?" And no, because I had just really been reasoning with him.
Right. Dad, why
And,
don't you
and,
understand this?
and amazingly, it was not working, so,
Yeah,
yeah.
it does. I mean, I hate that you and I both had to experience that, and that our dads had to experience that, but it just, we understand, right? We have a better understanding having gone through it ourselves, helping other family members, and I think the word that really resonates, this came out of COVID for me. And then like, it just has been kind of my word that I use a lot with family and with anybody, is we just have to extend grace to one another. I mean,
Right.
we're all going to stumble in this journey, all of us, whether it's us as a professional or as a family member, everybody's going to stumble. It's, how you do the next time, and one of those times you're going to mess up, and then you just kind of try to have to go the next time to do better. And it's a messy journey. It's a really messy journey. And everybody's different, so I know in support group, and you've been leading support groups for so long, it's not a one-stop shop, where one family is experiencing something, what we recommend to them may be a little bit different to another family member or another family, just because of the situation, the type of dementia, the dynamics of the personalities. You're going to use some of the same, don't reason, don't rationalize, don't argue, those things, but maybe approach is a little bit different depending on the family. Wouldn't you agree?
I absolutely agree. And one of the things that I've seen when you say, we've been at it for so long, is that I've got people who are caregivers for a whole different generation. I mean, they may have started out with me, because their mother or father had Alzheimer's, and now they're back in my support group with a spouse. And I just really feel for them. And it is surprising, but not surprising. Those two experiences are so very different, and they call upon such a different response from us, that for some of those caregivers, they've got to learn it all over again. And just because you did it one time doesn't mean you've got all the tools in the toolbox to do it well the second time. And so, it's helpful to continue to refresh. It's also good, just to have a sounding board, and that's part of what a support group is. And I do think these experiences seem so abnormal and so just, you just can't even believe it until you talk to other caregivers and you're around other caregivers, and you realize that everybody's experiencing the same kinds of things.
Absolutely. I mean, you're going through grief of losing the person that you've known. Sometimes that person, sometimes that person actually gets nicer. And maybe you've got these dynamics of trauma from how they used to be. Sometimes their personality completely changes and they're really ugly and hateful, and it's just, how do you care for yourself while caring for this person with so many changes? It's a balancing act. And, we just, one minute that person's doing really well, and then on the same day or within the week, things can change pretty quickly. And just knowing that you don't have to you don't have to do this alone. Right. So
Right.
there is a community, like you said, there is such a community now. There are resources out there, utilize them. Do not do this by yourself, because you can't. Definitely it takes a village to raise kids. I've said for a few years, it takes about 5 villages to help our loved ones living with brain changes.
That's exactly right. That's exactly right.
It's very multifaceted. Okay, so let's dive into those resources that are for the people that, and this is what's been, it's my favorite thing. This, our delivering the care baskets has been one of our favorite things to do in our house during the holidays. We love it. It's just an opportunity to visit those folks that receive services from ACA. And I've never seen a group of people that are more happy to, welcome you in their home, and we're delivering just something very simple, but they love it. And it's just such a great opportunity to see folks, that have dedicated themselves to take care of their loved one in their home. And a lot of times there's multiple generations living in that home, caring for grandma, grandpa, or an aunt, uncle, whoever it is. So the 91 cents of every dollar, what are those services? What are some of the core services that y'all offer through scholarship for these folks that are well deserved?
Well, the first program, it does not have any connection to income levels. It is really based, it's just a need base. And this is Project Lifesaver bracelets. And Project Lifesaver bracelets are they're like a big ugly watch. They emit a radio tracking signal, because we know that 60% of people living with Alzheimer's will wander, and those who do tend to do so repeatedly. And this is also true of people living with autism. They're also at risk for wandering, and they also frequently wear a Project Lifesaver bracelet if that's become an issue for them. We partner with the Jefferson County Sheriff's Department, so that's the heart county of Birmingham. But every county in Alabama through their Sheriff's Department offers this program.
So it's
And
now
the state,
statewide with all the sheriffs? I mean,
all the sheriffs and the state troopers also offer Project Lifesaver bracelets. So there's, if your loved one has wandered and you recognize that as a dangerous behavior, they really need to wear some type of either Project Lifesaver bracelet or some kind of GPS device. Project Lifesaver is radio tracking. It's not GPS. GPS, you've got to charge those batteries much more frequently. Some people don't like them as well, and law enforcement doesn't, because, for example, if somebody wanders away in Birmingham, the GPS signal bounces off all of the buildings, and it can be hard for someone to
like the air tag. Yeah.
Right. And so that's why they like radio tracking. But whatever works for you, it's just really important that you have used some kind of device. And lots of things have, come up over the years. Somebody made something that was in your shoes that you could track. Well, that's great, except they're not always wearing shoes. And because they're going to wander away at the most inopportune times. But the Project Lifesaver radio tracking bracelets are intended for people who are no longer driving, and they're intended for people who are living at home with a caregiver. So this is not a babysitting device. This is an additional layer of safety net that's really important. And we provide those bracelets free of charge. Their bracelets are available right now if someone needs one. Someone from the Sheriff's Department will come out and talk with the family, and they're very, very kind, and they're very understanding. Lots of them also have Alzheimer's in their family, so they know what the families are experiencing, and they're good at talking that person with dementia into putting that bracelet on. So that's really, really important. So that's the first thing that we offer. And then when I say largest, I mean largest when I'm looking at a budgetary standpoint, but not necessarily who we serve the most people with. But we've got about 74 people living with Alzheimer's throughout the state who are attending an adult daycare or respite program of their choice on an ACA scholarship. Now, these programs, when you think about the cost of bringing a caregiver into the home, a paid caregiver into the home, Christy, you know as well as I do, it's extraordinarily expensive, and families really suffer from sticker shock when they find out how much it costs, and there's 4-hour minimums, and it adds up so quickly. So adult daycare or your respite programs are your most affordable best buy. And here's the other thing that you get. You get the benefit of your loved one getting up, getting dressed, going somewhere where there are activities, where they can maintain a sense of purpose. They can maintain friendships and connections with people. They sleep better at night. They eat better during the day. Now, they may not be able to tell you when you pick them up what they had for lunch, but that doesn't mean a nutritious lunch wasn't provided. And so we just really believe in the benefits of these programs. It's good for the caregiver. It's great for the person living with dementia to be a part of that. It gives them community back. When we talk a lot about how isolating Alzheimer's is for the caregiver, it's also isolating for the person living with it. I mean, they don't get to do anything, and they do get bored at home. And the television set is no good babysitter for anyone. So you want your loved one to stay up and active and moving for as long as that's possible. And it doesn't work for everybody, but for people that it does work for, it works really, really well. Our scholarships are for up to $300 a month. So
Wow.
this is significant support. And again, for as long as your loved one is able to attend adult daycare, you're eligible to stay on the program. The daycare in Tuscaloosa, Caring Days, had a woman that she had younger onset Alzheimer's disease, and her husband enrolled her really because he was still working. And he found her in the middle of the street where she had wandered out. He had gone home at lunch to check on her. And that daycare maintained her and then started a program for late stage patients and took care of pretty much her exclusively. And Christy, you would just be amazed that she was still able to attend adult daycare and happy to be there and enjoying just the sounds and sights of other people, as opposed to being in a bedroom all day, which is where she probably would have been because she was just about a bed patient at that point. And so, the daycares really work with families to help make the programs work and to help give caregivers tips and strategies on how to make it work. And I just cannot recommend this level of care more.
I agree. I mean, the daycares we're so blessed to have those opportunities around the state, and I wish we could have more. Hopefully over the next several years, we'll see more of an emphasis on that because it's a lower cost to the families. It's all the things you just said. We're able to maintain them at home where they're comfortable, and private caregiving is, I couldn't afford private caregiving at my house. I mean, there's no way. It's just too expensive. And then the communities, there are some lovely, wonderful memory care communities. But then as you get into those higher levels, it sounds like this woman, very much so, if the family were to move her out of the home, she would have been in skilled nursing, and she would have never received the socialization, the attention, and being able to maintain being at home at night with her family, if that's the choice. So what a blessing. I know Caring Days has been around for a very long time and super active. I mean, I remember hearing that name and everything that they would do with having a team for the walk and so forth years ago. So it's been great to see them expand and grow, and they're quite a program in Tuscaloosa, aren't they?
They are, and there's also the respite programs that certainly deserve mention. Now, these are programs that are for people who can eat independently and can toilet independently. So a lot of the daycare population, is unable to attend for those reasons. It's 4 hours a day, and maybe not. The centers are not open every day of the week. They're mainly in churches and congregations, and there's 17 centers now in Alabama. There's 6 here in the Birmingham area. There are more slated to open, and so you can find those programs. Again, they're listed on our website, but you can find them on the Respite for All website, and they're doing a beautiful, amazing thing. And again, it's creating a sense of community. And it's a sense of it's just a whole lot of fun. It's just people having fun for 4 hours, and it's just a real blessing to the families.
Absolutely. If you can find either a daycare or a respite program in your area, I mean, recommend going and visiting. And for the respite programs, again, like you said, that's going to be they're a little bit they're able to do more things. We might say higher functioning, but like for the family, they're able to go to the bathroom by themselves. And they can be in a wheelchair as long as that maybe there's just a little minor help that they can do things on their own. And they serve an incredible purpose. It's been Daphne started this at First United Methodist in Montgomery, Alabama, and to see how it's expanded and exploded is great. And everybody's a little bit different, like you said. Some folks, some of the respite programs may offer 2 or 3 days a week that your loved one could come. Some, because of the demand of the program, may only offer 1 day. In Tuscaloosa, I know Lori at Connect has done kind of a hybrid, and she bounces around between a couple of different places, and her program is more like a 2 or 3 hour program. And so hers is a little unique of what she's doing to serve the Tuscaloosa community. But it's real exciting that we have these. And I know I want to mention McCoy Adult Day and South Highland in the Birmingham area. McCoy was probably one of the first ones. Either McCoy or South Highland one was one of the first ones in the area, and they're doing a wonderful job and have a full program there. And again, like you said with adult daycare, and this is something that families need to understand. Adult day can definitely be for the people that respite could serve, but it's also for the folks that are further along in their journey and may need more direct care, or maybe even a little bit of a medical care. Maybe they need to have medications given to them. So those adult daycare programs are going to have more healthcare staff involved, where the respite program is very volunteer driven, led by program staff.
And also for your caregiver that is still working, adult daycare is their only option, because 10 to 2 is what the respite programs, that's their hours of operation, and that doesn't work if you're a caregiver who's got a job to get to. So that's where adult daycare really fills an unmet need. Lower cost, but also providing just great services and great benefit to the person with dementia.
Absolutely. How many daycares are across the state? Do you know?
Well, COVID was not kind to our adult daycares, Christy, and we did what we could to help keep them open. We gave small grant. I mean, we just did everything we could to keep them open. But we've now got there are 5 adult daycares in the central part of the state. There's some in the Huntsville area, and I'm not even sure how many there are in South Alabama. It has not been a growing industry. It's a difficult business to do, and that's why these people who have done it well and done it for years are real champions in dementia care. Because no one's doing this for the paycheck. People are only doing this for the ministry of what providing dementia care is.
Absolutely. So staying on for the people that can be a recipient of this scholarship, you've got that on your website. The family will go through that. They'd probably meet with Cindy, right? So Cindy, that's on Alzheimer's with Central Alabama staff. She's over the programs, if you will. So Cindy would review the application and walk that family through what to expect and connect them with these communities.
Right.
Okay. What scholarship do you want to dive into next?
Well, continence care is the one where we serve the most families. And, this is getting into the more intimate and perhaps more difficult aspects of dementia care to talk about, but it's a fact of life. And, for someone living with dementia, living with brain change, incontinence is a real issue. And although we may think that we're not prepared to handle this with our loved one, we're going to be called to. And just like with a baby, you learn how to do what you have to do because you'd have no choice. But I often say, and again, I'm not trying to say anything that makes people uncomfortable. The people on this program tend to be very low income. About 60% of them have incomes that are less than $1,500 a month. And they truly don't know where their next clean diaper is going to come for their mother or their husband or their loved one. And it's hard to have a very peaceful day, to have a life full of joy and purpose and meaning when you're got that basic worry.
Yep.
And so that's what we started this program. Daycare was the first thing we did. And then continence care came along right behind it because I had a woman that called the office and she was wrapping her husband in plastic bags because she could not afford the continence care that he needs. Now, if you're committed to caring for your loved one at home, then I just feel like it's my mission and purpose to help give you these products to make that a reality because you can't do it without them. So we used to, and before COVID, we sent out a case of products so the caregiver could choose if they wanted diapers or pull-ups or bed pads, and then everybody got gloves and wipes if they wanted them or needed them. And they got one case a month, and we knew one case. A lot of people that gets them mostly through the month, but not all the way. Well, then COVID hit, and guess what? We all had insecurities about where things like toilet paper were coming from, and we realized, this is just not a worry that we want these families to have anymore. And so we've expanded the program, and now people can order what they need for the month. Wow. They have to call in and give us their order, but they can have the products that they need. Now, the products have gone up in price, and also doing this has extended the cost of the program, but we've gone from about $44 a month per family to $109 per month. So if you've got an income that is
double what you're providing them, amazing.
If you've got an income that is $1,500 and you're trying to scrape out the pennies that it costs, and more than that, the dollars that it costs for your continence care, and now that's provided for you, it really does give your whole budget a good
more
buffer.
than 15% of what they're receiving. That's huge.
Absolutely. It is really huge. It's really huge. So if they need bed pads and they need diapers, for the month, then that's what we provide them. And then another thing we started during COVID, and this is our final program, we had long wanted to do this and we just didn't have the money to do it. But when the daycares closed during COVID, we were able to pivot. And how we've been able to keep it all going now that the daycares are open, that's, again, I don't know, but it's happened. But we're providing Ensure and Glucerna. Now, there have also been shortages of Ensure, and the cost of Ensure went up. It finally came down. It's come down this year because they've repackaged it. So it's down to about $44 a month. However, about 20% of the people on the program are diabetic and they need Glucerna. And Glucerna is $77 a month. But these are products that can be delivered to the door. So again, they can serve anybody in the state, people in rural areas. And some of our families have transportation issues. So getting to the store is a big problem. And this just really takes one worry off of them, that these products are going to be there on their doorstep in a dependable way.
It's amazing. And we went from 7 counties, 20 counties, something like that. Now you've got the entire 67 counties.
We've got the entire. Right now we've got, last year in 2024, that's the numbers I can do off the top of my head. We served 399 families in 20 Alabama counties.
Wow.
So, if families ask, we could provide these services. And like you said at the top of our talk, that they're not waiting lists, and so we're ready to look at their applications if people want to apply.
Absolutely. Okay, well, these services are not free. And like you said, they all cost a lot of money in serving almost 400 families. And we haven't even gotten into the the research part. We'll get to there.